The origin of plastic surgery really was in how to deal with the traumatic injuries of war and how to try to bring back patients to their pre-injury state. We're limited by the extent of the injury, the ability of the tools that we use to create new bone, the amount of skin that we can use, the amount of soft tissues that we can close, and we come to a stop point. And what's interesting about Dr. Soo's lab is that she is basically trying to help our own body heal itself.
We all started off as a single cell, and the DNA in that cell told that cell what to do to grow all the tissues into the people we are today. So we have within our cells the genetic code to make essentially everything in our body. How do we understand that process better so we can guide our own cells to help us regenerate from injury or trauma? And then how do we prevent aging? Dr. Eric Ting noticed there was a subset of patients who have premature fusion of their sutures. Little babies, you feel the soft spots in their head, and that's because those bone plates aren't fused yet to give the brain room to grow. But if they're fused prematurely, the brain can't grow. And so he looked at that and asked the question, what is causing that bone formation? Well, that's how the NEL1 gene was discovered. So he took that and said, well, how can we use that?
There's a great potential as a therapy for bone loss, especially in children with craniofacial defects and in adults who have bone loss and bone fragility.
We've been focusing on the use of NEL1 molecule for bone regeneration for many years and had quite a bit of success. There was a day when a NASA scientist came to UCLA, and she was just looking for labs to tell them about this amazing opportunity at a national lab called the International Space Station. Next thing you know, we were given a project and we were on the space station.
We worked with NASA and SpaceX to send up 20 mice to the International Space Station to give them the drug NEL1 to see if it would form bone. The interesting thing about microgravity is it's a significantly accelerated model of bone loss. On Earth, after age 50, you lose about 0.5% of your bone mass per year. But in space, you can lose 1.5% per month. And so we thought, well, space is the extreme ultimate condition to test if NEL1 would work at forming bone. And it was very successful at preventing bone loss, so we were very excited. We could potentially have a much better therapy for osteoporosis. 1 out of every 3 women and 1 out of every 5 men will develop an osteoporotic fracture in their lifetime.
To be able to make a drug like NEL1, which works in a totally different way biologically than all the other existing drugs, it would potentially overcome that really terrible side effect that current drugs have. This research allows us to gain new insights, not just into bone regeneration, but also the growth and remodeling of other tissues.
We're the innovators in the surgical field, and we want to be able to then develop this new field of regenerative reconstructive surgery, where we activate your own cells to help your own body heal itself.
We would like to carry this momentum to the next phase. Now, hopefully in a few years, we provide a revolutionary treatment to patients.
This is serious medicine and with tremendous potential for long-term success. It would revolutionize the way we treat major diseases, major illnesses in our world.